Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look at the fusion of the skull fractures as well as the closure of the fontanelles So beginning with the posterior fontanelle. So under the posterior fontanelle, this is from 6 to 8 weeks. So when does the fusion of the skull bones and the closure of the fontanelle? So this takes place for posterior fontanelle is 6 to 8 weeks. Next, when you look at the lateral and occipital fontanelles, lateral and occipital, this occurs pretty fast, that is, it is less than 2 months. Next is when you look at the anterior fontanelle is in years. So anterior fontanelle will be in terms of years. So anterior fontanelle is from 1.5 to 2 years. 2 years. Anterior fontanelle is 1.5 to 2 years, and then is the metopic suture. So what is the metopic suture? The metopic suture is from 9 months. Is nothing but 9 months is the metopic suture. So the lateral and occipital fontanelle is less than 2 months, and posterior fontanelle is 6 to 8 weeks, and anterior fontanelle is where there is 1.52 years, almost 2 years. Posterior fontanelle is just 2 months. Next, let's looking at the metopic suture. The metopic suture is about 9 months. Next, what do we have at 20 years? So at 20 years is where there is the presence of the basifoot with the basisphenoid. Basifoot with the basisphenoid is associated with the around 18 to 21 years. So we are writing it as 20 years. Next is the sagittal suture. The sagittal suture is divided into 3. The sagittal suture is divided into 3 parts. So what are the 3 parts? The 3 parts is posterior, anterior and middle. So we have PAM, and it is considering the 1/3. So each of them they have 1/3 of separation. So this is ranges from 30 to 50 to 60 years. So 30, 40, 40, 50 and 50 to 60 years. And it goes in order of PAM, that is the posterior, anterior and middle. Next we move on to the congenital, the coronal suture. So the coronal suture has the lower half and the upper half. The lower half means it is 40 to 50 years, and the upper half means it is 50 to 60 years. So we can write it as 40, 50, 60. So it starts from 40 to it goes up to 60. Next is the lambdoid suture. Lambdoid suture is when there is 45 years. So lambdoid is where it goes at 45 years. Then is common temporal suture. So greater than 80 years. So what do we have greater than 80 years? Greater than 80 years, it is always the squamous temporal suture. To learn and grow daily like this, please do subscribe.